Warringal Private Hospital is a leading private hospital located in Heidelberg, Victoria, directly across the road from Austin Health. The hospital has 220 beds, 11 operating theatres, 2 cardiovascular procedure centres and a 6-bed ICU. And the services offered here include cardiology, orthopaedics, general surgery, oncology, ENT surgery, pain management and many more. Warringal's highly reputable cardiologists and interventional cardiologists conduct approximately 140 cardiac surgeries per year and about 250 interventional procedures each month. We will now take you through the hospital and what you can expect when coming into Warringal Private Hospital for a cardiac procedure. 1 to 2 days before your planned procedure, you will receive a phone call from your cardiac case manager confirming your personal details and provide you with all the relevant information prior to arriving at the hospital, such as admission time, items to bring into the hospital and what to expect whilst you're in hospital. They will also discuss your planned discharge, cardiac rehabilitation options and provide you with an information booklet around preparing for surgery. This is a good opportunity to ask any questions you or your family might have. When you arrive on the day of your procedure, the friendly reception team will direct you to the admissions area. Here you will meet with members of your healthcare team who will review all the important information about your stay in hospital, including inpatient rehabilitation and dietary requirements. A questionnaire regarding your medical history, allergies, medication and lifestyle will be completed. Tests such as blood tests, ECG and X-ray will be taken and other information such as height, weight and blood pressure will be recorded. This information is important as it allows us to refer to other specialist services if required. After you've completed your paperwork at reception, a nurse will bring you into the day area of the cardiac cath lab. Here, the nurse will check your OBS, take your ECG of your heart and complete your medical admission. An IV cannula will be inserted into your arm. Your doctor will get you to sign a consent form for the procedure after he has explained what the procedure entails and the risks associated with it. Next, you'll be brought into the allocated procedure room. Once you're on the procedure room table, the nurse will give you some IV sedation to make you relaxed. Your procedure may take anywhere between 45 to 90 minutes. After your procedure, you are transferred onto the recovery area where you will be monitored. The nurses will keep a very close eye on you while you're in the recovery area, doing your OBS and checking your puncture site in your groin or wrist for bleeding or bruising. You will be offered a drink and sandwiches. If you're a day case patient, you will remain in the day area on a trolley for around 4 hours. Then the nurse will discharge you from there to your family. If you require a stay in hospital overnight, you'll be transferred to the cardiac ward. After your cardiac procedure, you'll be taken to the intensive care unit for around 1 to 3 days for close monitoring by your healthcare team. During the first 4 days post-surgery, 1 immediate family member can visit you. After this, 2 visits a time can visit between 3 and 8, unless pre-arranged with the nursing team. A rest period for patients is scheduled between 1 and 2 and no visitors are permitted during this time. After your ICU stay, you'll be transferred to the general cardiac unit and your inpatient rehabilitation will commence. Early mobilisation is important as it helps prevent lung and circulation complications. Your physiotherapist will give you specific exercises and will support you gradually increase your daily activity until you leave the hospital. Most patients who have undergone a cardiac surgery will usually leave hospital in around 6 to 7 days after their procedure, once they've reached the goals required for discharge. All arrangements for your departure from hospital will be discussed with you and your family prior to discharge. After your hospital stay, you may require rehabilitation to support you and regain independence and manage everyday activities. Rehabilitation options include home rehab, inpatient or outpatient rehab, and this will be discussed with you and your doctor and healthcare team. If you have any questions after watching this video, please feel free to contact us via phone or email.